Hi, everyone. Thank you for joining us today on this webinar entitled Advanced Combinations. My name is Nima Garavi. I'm a board-certified dermatologist and fellowship-trained Mohs micrographic surgeon in Los Angeles, California. I also serve as Director of Dermatologic Surgery and Mohs micrographic surgery at Cedars-Sinai Medical Center. And I've been using the InMode technology since the early days, back in 2012, and was involved with some of the original studies on Fractora and Body FX. Before I introduce our esteemed speaker, I just wanted to go over 3 housekeeping items. First, we're going to have a Q&A session after the talk. You're welcome to write down your questions in the meantime, or put them in the chat box at the bottom, or the Q&A text that will appear. At the end, I'll help moderate the Q&A. Number 2, your mics and videos are off. They're muted. So if you're in your pajamas for the 3rd day in a row and your kids are screaming in the background, or you're at work and your staff is being rowdy, it's not a problem at all. And then 3, this presentation will be recorded and will be posted in inmodeuniversity.com for future reference. With that, I'm excited and honored to introduce my colleague and our speaker, Dr. Natalie Curcio. Just to give you a quick background on a very impressive CV, Dr. Curcio is a board-certified dermatologist, as well as double fellowship trained in cosmetic and laser surgery, as well as Mohs micrographic surgery. She's always been a leader in surgical and cosmetic dermatology. Dr. Curcio is the founder and president of Curcio Dermatology in Nashville, Tennessee. She has served as a consultant and luminary for several laser and cosmetic companies, including InMode, and she's constantly lecturing on surgical and cosmetic topics at both the national as well as the international level. Natalie, I'm excited to hear you speak. I've heard you speak on several occasions, and I always learn a lot from your lectures. With that, Dr. Curcio, it's all yours.
Thank you so much. I'd like to thank InMode for this opportunity. I'm really excited to talk about some of my favorite devices, the Lumecca, Forma, and Morpheus, and some of the advanced combinations that we have the opportunities to use on our patients, and some of the wonderful results that we can produce. And thank you to all the participants that are joining us today. So Nima already mentioned a little bit about my background. I work a lot with lasers, injectables, and cosmeceuticals for patients. And let's go ahead and dive right in. We're going to be focusing on those 3 handpieces that are on their Optimus platform. And without further ado, we're going to get started with one of my favorite devices, the Lumecca handpiece, which is their IPL. So the Lumecca has been a breakthrough intense pulse light that delivers 3 times more energy in the 500 to 600 nanometer range for improvements in vascular and pigmented lesions. And with this optimization, you can actually achieve better results for your patients in fewer sessions. So why is it so efficacious? That's because of its high peak power and optimized output. For most patients, in 1 to 2 treatments, you can achieve the same results that other IPLs would achieve with 4 to 5 treatments. The reduced treatment time is thanks to the large spot size and high pulse repetition rate. It has nice, strong sapphire cooling tip, which is increased comfort for your patients. And basically, you can double your per treatment revenue with this. People see dramatic results in days, not weeks. They have a reduced number of visits with better outcomes. And basically, you can increase your revenue by charging for 1 to 2 treatments what you would normally charge with 5 with a typical IPL device. So some of the advantages, like we mentioned, is large spot size, high efficiency. We're going to primarily today be talking about the 515 cutoff filter, which is for the pigmented lesions. There's also a 580 nanometer cutoff filter for vascular lesions. And with these laser-like parameters, you have concentrated energy with a high pulse repetition rate. It's a very ergonomic laser-like handpiece for ease of use of the clinician. And it has an exclusive low pressure xenon lamp. So when we're dealing with pigmented lesions, we have to remember you're targeting those pigment that's in the epidermis, at the dermal epidermal junction, and then the dermal pigment layers. So let's see some of the results for the Lumecca. So here's a nice photo of before with someone with some scattered solar lentigines or sunspots on the cheek. 24 hours after, what we expect is darkening of the pigment. I like to explain to people it's like sprinkling cinnamon on a cappuccino, or the way people look after they get a suntan. And then after 2 weeks, the pigment has sloughed off the skin and you get a nice even tone to the skin. And I think this person has used pretty typical settings. It's a type 1 or 2 skin person with 14 joules, short pulse duration with strong cooling, and 2 passes on the skin. Another similar patient with similar settings, light to medium colored solar lentigines, 2 passes with 1 treatment. Here's one of my patients. This lady suffers from diffuse small sun freckles all over her face. We did 12 joules, 2 passes, 1 treatment, short pulse duration, and you can see 6 months post-treatment with a person using, sunscreen, skin brighteners, and sun avoidance. She's had maintained results. Here's somebody with a little bit darker skin. It's hard to tell from this angle if it's a type 3 or a very light type 4, probably using a longer pulse duration in this skin type. Some larger and some smaller solar lentigines scattered across the face, submental area, and on the neck. Really nice results. Another patient, again, not mine. It's hard to tell if it's like a type 3 or a light type 4 here. Probably a type 3 if they're using a shorter pulse duration, 12 to 15 joules with strong cooling. Dr. Vic Ross out of Scripps. Another lady here, it's the 515 nanometer filter at 12 joules, 2 passes, 4 weeks post-treatment. We're gonna take a look at her frontal picture here and a side view picture here. And you can see almost all the lentigines that were fine have resolved, and she just has 1 or 2 still remaining on that right cheek that she could probably have a second treatment and that she would get full resolution. Here's a patient of mine, a British lady in her early 40s. When she first came to talk to me, she had said, "I'm not sure if I want IPL. These are freckles from my childhood." And I said, "Some may be freckles, but I think you've developed some sun damage over the years." So we did 2 passes, 1 treatment, 12 joules. She had resolution of nearly all of her sunspots. And actually, someone had walked by her on the street and didn't wave. And she went up to her, it was a neighbor, and later, and had said, "How come you didn't say hi to me?" She said, "Well, you were the freckly British girl. I didn't recognize you with a perfect complexion." So some people get associated with these sunspots, which are sun damage, and don't realize that they can look years to decades younger when they're actually removed. So after they were removed, she said, "I never want those back." Here's another patient of mine. It was an elderly man, not very into cosmetics, but when his grandchildren started telling him that, "Hey grandpa, I hate these like little ugly brown spots on your hands, you look like a toad," he decided he'd get them removed. So 2 passes, 1 treatment, 4 weeks apart, he had complete resolution of the solar lentigines on his hands, again with a short pulse duration and strong cooling. So what are my favorite settings for the Lumecca? For types 1, 2, and a lighter type 3 skin, a short pulse duration with strong cooling between 12 to 14 joules, 2 passes. With a darker type 3 or a light type 4, you're gonna lower the fluence and use a longer pulse duration. I also bring up mixed ethnicity. There are people who may walk in the door like me with light hair and light eyes. And I always ask people what's their ethnic background. I've had people that look like me and are like, "Hey, my dad's a dark-skinned Persian," or "Hey, my dad's African-American." You always have to treat towards the darker ethnicity. So that's really important because people will react to lasers like they're darker half. Like you can't probably tell, but I'm half South Italian. My brother and my dad's side of the family are much darker than I am. So that would be different than somebody who's both sides of their families have blonde hair and blue eyes. So just keep that in mind when using really any kind of laser, but especially something like IPL. Caution with the chest, especially you often need lower energy, and I'll start with 1 pass. I've had people that I thought I've done their face and neck, there's no difference, and they ended up blistering up on their chest when I was earlier in my career. And people who maybe they look like They have my color skin, but they come in super tan. It's not really a great treatment when people have a lot of tan skin. So you should let the tan resolve before treating with IPL. And this is not a great treatment for melasma. So those people do better with chemical peels to lift the pigment than they do with an IPL, because that can actually worsen the melasma. I often sell my Lumecca in a package of 3 treatments, not for patients a discount if they buy the package of 3 up front. And I generally treat every 4 weeks. So one of the advanced combination is Lumecca with radiofrequency. So many people who come in with hyperpigmentation have photoaging, fine lines, wrinkles, and laxity, or maybe also acne scarring. So usually one device cannot treat all these issues. So I offer a combination package with Lumecca IPL for pigment, and then radiofrequency, previously Fractura, now Morpheus, for the photoaging or acne scarring. So people always ask me, well, what do you do first? So what we do is I ask the patient, what bothers you more? There's not one right answer. So we, based on the patient's desires, we use one device, treat that problem, and then we treat the second problem. So here's a lady, obviously fine lines, wrinkles, laxity, a lot of sun damage. She spends about 4 to 8 hours a day outside playing tennis year round. It does get cold in Nashville. That doesn't stop these people. So she had 2 fractura on her face and then 2 IPL on her face and neck. And so you can see much improved results. And then here's a little bit closer up picture of her. I didn't see her for about 3 years. She just decided tennis was more important. She came in, she looked worse than she ever looked, freshened up the pigment with some IPL, and now she signed up to do Morpheus. Another lady, she was 42 when I first met her. Terrible acne scarring all over her back. Lots of little holes, lots of hyperpigmentation. She decided to do 2 IPL, 1 fractura on her full back, and then 2 IPL. After the results of the treatment, she said she'd put a bathing suit on for the first time in 20 years. She had never had enough confidence to actually show her back. So here's a little bit of a closer up picture of her back. You can definitely see the improvements in texture and hyperpigmentation. Had some personal issues, didn't see her for about 18 months. And then she heard that I had the Morpheus now, and she just finished her second, is coming in for her 12-week photos next week. So I unfortunately don't have them to show, but she's had even more continued improvement with the 2 additional Morpheus treatments. So many of the people that had fractura and are treating either photoaging or scarring had the IPL, they eventually keep coming back because problems like pigment or scarring don't just go away entirely. So what about Lumecca after Kybella? So many people get focused on a single issue on their face or neck, such as submental fullness. They pursue Kybella until they're satisfied. And then once they fix one issue, all of a sudden they see something else. So now they don't have a double chin, but now they're like, oh gosh, I have spots on my face. So Lumecca for men, of course, you have to either do non-bearded areas, or if men don't have a beard, like a female face, then you can treat the whole face. So this gentleman came in and he just said he was sick of looking fat, always putting on weight on his face, had a really heavy double chin. He did 4 treatments with Kybella, and then he said, gosh, I have some like solar lentigines, can you make my complexion brighter? So then we did 2 IPL treatments, and the man looks like he lost 40 pounds just by fixing his neck, and then his skin and his complexion is more radiant. And then it's interesting with men, you know, once you get their trust in one thing, they're generally yours for life. Then he was like, IPL, then he goes, well, what else can I do? And I said, well, if you want to maintain that like shiny face and that brilliant glow, why don't you try a skin brightener, some anti-aging peptides? What about a great neck cream for your neck to keep it looking so great? And he's sold. So then, you know, then they're willing to try the cosmeceuticals once you show them what you can do. So he had great results. So now on to Forma. So why do I love it and why does everybody love it? It's non-invasive and pain-free treatment with radiofrequency. You can treat nasolabial folds, cheek rhytids, jowls, neck, forehead, lower eyelids, and there's no downtime. A lot of times people call these like lunchtime lasers or lunchtime procedures. So we're going to talk about the Forma for the face and neck, but there also is a Forma Plus body handpiece as well. So a lot of times people talk about this ACE control. Acquire, meaning you acquire the epidermal temperature, you maintain an optimal temperature with a good contact throughout the dermis, epidermis, and down to the adipose tissue. It has a good online feedback control, and then you can extend the time of treatment so you get the optimal endpoint. It improves the skin texture, and you get a new production of collagen, elastin, and ground substance in your dermis. So what are some of the built-in features of Forma? You get the constant epidermal thermal monitoring, which is great. It prolongs the heat at the desired temperature, so you have both time and temperature control. You have a great feature, which is the radiofrequency cutoff at the endpoint. When you hit the target temperature, it basically cuts off the heat, so you can't burn the patient. There's no temperature spikes, which leads to both safety for the clinician and comfort for the patient. You have constant contact monitoring, and it redistributes the RF so you don't have any arching or, again, chance to burn the patient. This is something that my esthetician does. I feel completely safe and comfortable, and I've never had an issue in over 6 years. I really like this picture. It shows the uniformity of the heating, the comfort for the patient. It maxes out usually at a cutoff of 43 to 44 degrees centigrade within 60 seconds, excuse me. And you can kind of see the patient's face with the nice uniform heating and the target temperature. So we're going to look at some nice before and after pictures with the Forma. This lady, you can see the deeper righted around her anterior inferior cheek just beyond the nasolabial or fold or marionette line has been improved. It's tightened her neck wrinkles. It's tightened her overall neck skin, and she's had both laxity and textural improvements. And here's another picture of her with improvements in both the neck wrinkles, the jawline, and the submental laxity. This lady, a little bit different. She's got thicker neck skin. She's got more sagging, more wrinkling, and had beautiful results here with 8 treatments. And here's her profile picture, much more tightened skin, fewer wrinkles, and a more sharp jawline profile. Here's a patient of mine. We use 45 millijoules in my practice with a 43 degrees centigrade cutoff temperature, 6 weekly treatments. And these patients, sometimes you look at, you're like, wow, she's got heavy cheeks. She's got kind of a heavy neck. She's got a heavy jawline, and you think they're not going to be able to achieve optimal results. After her second or third of 6 treatments, she went to a company party, and people actually asked her if she had either a thread lifting or a small face and neck lift, because people could notice actually what a strong result she had with something non-invasive. She was thrilled. So another lady, of course, younger than some of the last 2 people we looked at, really nice results at the nasolabial fold area. Probably an older gentleman, nice lift in the submental area with the laxity at the jowl area, the lower face and jawline. Another lady, again, very nice results, improvement in the jowling, the submental laxity, the overall neck rhytids, and neck lift. This lady here, it's kind of interesting to me, with just Forma, she's had actually improvement in texture. I always joke, with people, if you ask me what this patient had, I would have said when I first started Fractora, because her textural improvement was so nice, but you can achieve that with Forma as well. And then you can also see the lifting in the submental area. And then another lady with nice lifting at the nasolabial folds as well. This is another gentleman, great lifting in the submental area along the jawline, the jowls, and even that kind of etched in wrinkle that's just beyond his nasolabial fold. He had nice textural improvement there as well. And then another lady here, really nice tightening along the jawline and the neck. That's clear in the before and after photos. So my favorite settings for Forma, an energy of 45 with a cutoff of 43 centigrade. We do weekly sessions for 6 weeks for a total of 6 sessions. You know, how long is it going to take? Most people, it's about 45 minutes, but a thicker, heavier face and neck with more fat and adipose tissue to heat is going to take longer. We usually recommend doing, you know, a whole cheek or a half of an anterior neck, 10 minutes per area. In somebody with a larger face, like a larger cheek or a larger neck, you can split those into 2 5-minute areas if you're losing heat with a larger area. Smaller areas like in the periorbital area, just around the nasolabial fold, or if you're just splitting the cheek or neck into 2 smaller half areas, would be 5 minutes per area. And then the one thing I think that's important is because you're not sticking needles in the face, it is non-invasive, it's not permanent, and people need to know that. So something that I've come up with that's helped people understand is I liken it to a dental appointment. You know, they recommend getting your teeth cleaned every 6 months. Some people can go every 12, but there's nobody whose teeth are as shiny and fresh at 12 months after cleaning as opposed to the day you left the dentist office. So a touch-up treatment every like 2 to 3 every 6 to 12 months is going to help you maintain that tightness and avoid the return of the laxity, the sagging, and the wrinkles, and also maintain the improvements in texture. So most people, when you give them that scenario, actually get it a little bit better. And I've had people that come in every 6 to 12 months for a touch-up, and then I've had people do a full session, and then 2 years later, their daughter's getting married, and they come in for another full session because they had great results. But the key is that it's painless and has no downtime, so I call it a gateway therapy. So a lot of people who might want to do Morpheus but are too afraid, they see how great the results are with this, and they're like, heck, I'm just diving in and going for that Morpheus now. And then some people do Morpheus, do this in between, and then do another Morpheus later. So it's really nice in combination. And so I have used Forma after Kybella as well. So sometimes people get such a brisk fat loss that they have some saggy skin left, even though they've had some submental skin tightening. And so Forma is the perfect solution. So this gentleman came in, he had 4 Kybella treatments, and he said, you know, I haven't seen my Adam's apple in 4 decades. And so he did have some excessive laxity in the submental region. So he did 6 sessions of Forma, and his neck was quite tight after that. He just kind of needed that to boost the effects of the Kybella. So he was thrilled. And he was so happy with his Kybella treatment and how much fat loss he had, he was happy to pay for the Forma. So now on to Morpheus. So Morpheus is our fractional technology to deliver RF energy to the subdermal and adipose areas. And it's intended for use in the dermal and general surgical practices for electrocoagulation and homeostasis. So when we think about what we're trying to do with the Morpheus, we have to think about the skin's aging. So there's intrinsic and extrinsic aging. Intrinsic aging is due to the degradation of collagen that happens to us all, whether or not we lived in a cave and never was out in the sun, just because we're getting older. Extrinsic aging is due to the UV radiation we call solar elastosis or photoelastosis. So all of this aging in the dermis leads to the skin becoming less elastic, having more sagging, development of wrinkles and fine lines, a decrease in nice skin texture, and a worsening of existing scars, or people saying, wow, I had acne and I never had scarring and now I do. So scars that were underlying start to become actually visible. So that is right in alignment with what our indications for radiofrequency rejuvenation are. We want to improve fine lines and wrinkles, improve scars and irregularities in the skin, improve uneven skin texture, improve laxity and sagging of the skin, help to decrease the appearance of stretch marks, improve acne scarring, and it's safe for treatment all over the body, face and neck, unlike things like CO2 and erbium, which can cause scarring off the face. And it's safe for all skin types, which is not true of other fractional ablative technologies. So fractional RF takes advantage of the healing power of healthy tissue around micro treatment zones. So the thermal injury heats up the collagen to stimulate new collagen formation or neocollagenesis. So you get improvements in both laxity and wrinkles and texture that are commonly seen with intrinsic aging. So there you can see a nice, beautiful video of the Morpheus with its coated tips going all the way down into the adipose tissue. So I think it's important to just think a little bit about what are some of the thermal biological effects that occur and where the Morpheus fits in. So at 40 to 50 degrees centigrade, and that would be where the Forma fits in at that cutoff at 43 to 44 degrees, that's where you're getting heating in the skin and stimulation. At 50 to 80 degrees is where you're getting coagulation or necrosis with collagen contraction. And then at above 80 degrees centigrade is when you're getting collagen denaturation. So the actual pinpoint tip of the Morpheus heats up to 80 to 100 degrees centigrade. And then above 100 is when you're getting ablation or evaporation. So with this device, you're getting a wound healing response, which increases things like metalloproteinases and collagenases in the skin. And these enzymes will start dermal remodeling, helping to remove photo-damaged tissue and allowing for the deposition of new, fresh collagen and elastin. And here's a picture of porcine skin where you can see a tip has been inserted. You have a coagulation zone at the very depth where the tip is uncoated, but your top of your epidermis and dermis is relatively untouched. And then 14 days later, you've got new collagen that's beginning to start to be deposited, but then the skin is fully healed. So what are the specifications for this device? So you can see a close-up of one of the needles. It's the device head has 24 sharp polymer coated gold needles that go 1 to 4 millimeters into the skin with virtually no damage to epidermis. And these gold needles are something kind of unique to the Morpheus. They can penetrate into the adipose tissue up to 4 millimeters with a thermal or heat effect down to 5 millimeters. The device has the most uniform effect of any RF device on the market. It's deep and safe technology. If we include the other tip, which is the resurfacing tip, you can get penetration as superficial as 0.5 millimeters. All the tips are sterilized. They're single-use disposable tips, and they're minimally invasive, and they're designed for either dermal treatment, epidermal resurfacing, or subdermal adipose remodeling. They're safe on skin types 1 to 4 with little risk of post-inflammatory hyperpigmentation when you use the coated tips. And the variety of tips and depths enable targeted treatment of specific facial and body areas and issues. So this is the interface on the Morpheus screen. The LED bar on the applicator indicates the depth of penetration and your energy. And then there's 2 modes you can use. The cycle mode shows where needles penetrate the skin and retract from the skin with every single pulse. And the fixed mode has the needles stay protruded where the RF pulses are delivered with a predetermined repetition rate. So on the right, we see the original Morpheus tip that has a length of 1, 2, 3, or 4 millimeter with additional 1 millimeter of heat profile and depth. And these are coated with that polymer. Most people do, I would say on average, 2 to 3 sessions with these spaced 3 to 6 weeks apart. And the average downtime, I would say, is between, in my practice at the settings I use, 3 to 4 days. You can get subdermal and dermal remodeling with a fractional coagulation and bulk heating. The newer Morpheus resurfacing tip on the left, they're 0.5 millimeters. They are just the tips, so they're uncoated. They are at a fixed length. They do not retract. And similarly, a lot of people combine this with the original tip. So the sessions, the weeks between sessions do the same, and they may have slightly lower extended downtime. And then the epidermis and dermis would have the fractional resurfacing with this tip. So here's a gentleman receiving Morpheus on his forehead. And they're using a double pulse there with on the fixed setting. And here is me doing someone's abdomen with the Morpheus. She has severe abdominal striae from pregnancy. She's had multiple fractura and multiple Morpheus treatments. And here you can see this is immediately after treatment, what to expect. You should have a nice, like, confluent erythema. You shouldn't have bars or spaces between the treatment areas. And I always tell people it kind of looks like a sunburn. So proper patient selection is paramount really to any cosmetic procedure, but especially something like the Morpheus. You want to look at their skin and you want realistic expectations. I once had a lady come in who was 70, who was bald and looked like Mother Teresa, was like a glow gal, stage 4 photo aging. And she brought in a picture of her at 25 and said, "Can you make me look like this?" And I said, "No, you're gonna have to go see a plastic surgeon. You need a facelift and an eye lift, a blepharoplasty, a brow lift, a neck lift." I mean, it was beyond what I could do. She did not have realistic expectations. So those are the people you want to say thank you, but no thank you. You want to review people's medications, see if they have anything that's contraindicated. They should arrive with clean skin, no lotions, creams, or makeups. We do photos before every treatment. I mean, you have to wipe off the makeup and everything before the treatment. Wash them with antibacterial soap. Make sure your topical anesthetics are ordered in advance by somebody who's properly trained and you know where they're coming from. And then we'll talk about wiping off numbing cream, but you want to make sure it's removed properly and it's not getting in people's eyes. So always inspect the tips for damage. Just because they come sterilized and prepackaged doesn't mean there couldn't be a manufacturing defect. Anybody with a history of HSV should be on some kind of oral prophylaxis like Valtrex. I once had a lady who refused to take Valtrex because she said, "You're not treating my vermilion lips, like the pink part of your lips, and I use a lip balm anyway, so it's not going to matter." And sure enough, after treatment, she broke out with herpes simplex on her chin. So I do not treat people if they refuse to take Valtrex and have a history. You have to become very firm in your rules. Remove the numbing cream from the treatment area. We first wipe it off with rough gauze. Then we use a foaming cleanser and have people scrub their face and neck on the sink. Then we degrease it with 70% rubbing alcohol to make sure it is all off. If people have never been treated or they have darker skin, it's always wise to do a few test spots if you have any doubt about people's reaction to post-inflammatory hyperpigmentation, or if you think the tip is something's wrong with the tip. Like we said, all tips are gamma sterilized. You want to check them before you use it to make sure the tip is visibly clean and dry, and always make sure the handpiece is well, and make sure you put the tip on properly. It takes like 1 or 2 to make sure you've got the quick click on. And one time at first I didn't have the bottom pieces clicked in and I was trying to fire it and I just, not on a patient, realized it wasn't in correctly. So make sure the tip is on the handpiece properly. So everybody gets this list of contraindications from the company. I just wanted to highlight a few. People sometimes have metallic or electronic implants in places you wouldn't think. I once had a lady who was going to get Forma almost forget to tell me that she had a metal chin, and that could have been disastrous. I've had patients with metal jaws after really severe car accidents. People just have gotten so used to it, they literally forget to tell you. So it's really, really important. Dental implants are big. Some people have a mouthful of metal and really can't have this treatment. Pregnancy and nursing, it seems, pretty straightforward. You wouldn't want to do this on a pregnant person, but I've had people be like, "Oh, I mean, what's the big deal with nursing?" Well, you're putting all that topical lidocaine and tetracaine all over people that you don't want getting into the bloodstream of a pregnant woman or in breast milk. So sometimes people are like, "Well, I don't care," but you need to care. Keloids, it's definitely a contraindication if people have a history of severe hypertrophic scarring or keloids, any kind of abnormal wound healing. People, if you're treating body areas, have sores, psoriasis, eczema, rashes everywhere. No. I will not treat people who are on prescription factor 10A inhibitors, Plavix, Coumadin. I know people who do, but it's just not worth, if there's like bleeding you can't get stopped, and then people have tons of scabs and they're all upset. It's just better to avoid that. And then I will not touch somebody within 6 months of isotretinoin, because even though some people have said it's okay, if they scar and you do it, you've just lost the lawsuit. So my choice for anesthesia, we use a plasticized lidocaine tetracrine 23/7. I get it compounded in California for 60 minutes. One thing that I found fantastic about Morpheus is, compared to Fractura, I don't need to do nerve blocks. I don't need to use local anesthesia. We typically treat people at 30, an energy of 30 to 35 on the Morpheus. And so with Fractura, I was having to do nerve blocks and injectable anesthesia. All of my people that have had both Fractura and Morpheus say it's so much painful. The needles are smaller, they're rounder shaped as opposed to triangular, and it makes so much difference. And everybody has said I would do Morpheus over Fractura in a heartbeat. Now, if you're using tumescent or IV sedation, you might need that if you're using more aggressive protocols like plastic surgery patients, or if you're using face tight or AccuTite or body tight with this, of course, that would be a different scenario than what's going on in my clinic. I require everybody who does Morpheus, IPL, vascular lasers to have photos in Visia before every procedure. With Morpheus, they do it at time 0, at 4 weeks, and then usually we do a second treatment at 4 weeks, and then 12 weeks after the last procedure, because people forget how bad they looked and think there's no improvement. And then when they look at the photos, they want their money back, and they'll say, oh, I really look that bad? Gosh, I guess I do look better. So that's your kind of proof that what you're doing is beneficial and helpful, and people that are the infinite doubters, or people that just have lived with acne scarring their whole life and feel like nothing is good enough or better. We mentioned about the cleansers. I usually do 1 to 2 passes on the face, neck, or chest, depending on the person, 50% overlap at 30 to 35 watts for the face on skin types 1 through 3. I will do a 3 millimeter, then a 2 millimeter depth, of course, lower energies for sure on darker skin types 4 through 6, and then a periorbital depth with a cycle mode on bony areas such as forehead and perioral regions. I definitely use a Zimmer cooler during the procedure for patients' comfort. If they refuse it and don't want it, I don't force it on them. We keep our office very cool, and so some people are cool enough and they don't want extra chilling and they start shivering. So, like I said, here's my favorite settings, like I just mentioned here on the screen, for the cheeks, chin, lower face on the left, and then for the periorbital, forehead, and nose on the right. So for post-treatment, I feel that cooling the skin can reduce discomfort. So I offer to anybody who wants it, we'll do immediate topical application of PRP. If they don't want to do PRP, a biocellulose mask post-procedure. Then when we remove the biocellulose mask or after the PRP, I use the elastin regenerating skin nectar immediately post-treatment. I usually recommend about 4 times a day, breakfast, lunch, dinner, and bedtime for the first 2 to 3 days. After 48 hours, which is initially when we say, like with the Fractura, the uncoated tips, the holes had closed, then they can switch over to their restorative skin complex and their Trihex Duo twice a day, followed by a broad spectrum physical sunscreen of 30 or higher, and then makeup if they want to wear makeup. I usually have people avoid retinol, any kind of like salicylic acid, vitamin C, any kind of scrubs for 1 week, and then stay out of the sun, avoid UV and IR radiation for 2 to 4 weeks to avoid any kind of post-inflammatory hyperpigmentation. And then, if somebody is not interested in using the Trihex Duo, I've used for many, many years Neocutis Bio Cream, safe post-procedure. Definage 8-in-1 Bioserum can be applied after 48 hours over whatever other product you're using. They've done split studies after Fractura on the face and the arms, and it showed superior results to just the other product alone. And then it is important, a lot of people are like, oh, I already have my favorite sunscreen, but it's not safe like post-procedure. So I'd rather them use something like Elta MD UV Clear, which is safe post-procedure. So we know they're not having like any kind of allergic contact dermatitis or breakouts after the procedure. So people always ask about Botox and injectables. So usually the company policy is, you know, Botox 14 days before or after Morpheus. Most of my patients come in 14 plus days before the procedure. So that way their facial wrinkles are smoothed out and their skin can remodel without kind of the crunching of the dynamic wrinkles in the upper face. You know, that's been shown in Mohs surgery and stuff. When the skin can heal without the actual pulling of muscles and wrinkles, you get better results. And that, I think that would apply here as well, or they could wait till 2 weeks after. InMode's official policy on fillers is that they should be injected 4 weeks after or 6 months before with Morpheus. Most of my patients, you know, when people have wrinkles, there's some that we mentioned due to like solar elastosis or intrinsic aging, and then some are due to fat loss, especially like with perioral lines or in the mid-face. So I like to treat all of the ones that we can with Morpheus first, and then they usually come in for filler 4 weeks after the Morpheus, and then we see what we can touch up, and then people usually need to spend less money on filler. So a lot of people have asked who've never done PRP, gosh, how do you even use it? Well, the nice thing is, this is just very quick. Once you have open holes, your face is ready to accept the PRP, because if you don't pour it on open holes, then you have to inject it intradermally, which is very painful and also requires numbing unless you're mixing it with filler. So this, oops, I'm sorry. This is just a quick video showing I treated the right side of this person's face and neck, and I'm just pouring the PRP over, and it's going right in. And this patient has had many, many Fractura and Morpheus for severe acne scarring. And he said it definitely increases redness and swelling. He's not saying he's gotten better results, but the decreased erythema and swelling he feels is worth it. So just one note about technique, you want to use good coupling. You want to apply the handpiece perpendicular to treatment area, apply firm pressure, stretch the skin on soft tissue or pinch it over bony areas, and ensure that the patient is steady and still during the procedure. It's worth taking a little extra time to get better results. And we mentioned about reducing the energy over certain areas. And the main reason for this is if you have the handpiece twisted or the needles are popping out, it can cause these side effects called superficial arcs, which are these small linear scabs. And that can be the result of very soft tissue, not enough pressure, or not a good perpendicular firm contact. So we want to try to avoid these on patients if we can. So one thing people always ask about is axillary hyperhidrosis. I was very excited to try this with Morpheus. I've done about 15 patients over the past 15 months. We use the protocol based on a case report with Fractura, doing 3 passes at 3, 2, and 3 millimeters in an attempt to theoretically kill the apocrine and eccrine glands. 35 watts, of course, lower energy for darker skin types. I have done one type 6 patient at 25 watts. We triple pulse the Morpheus. That has been superior results to double pulsing it. We use the 23/7 lidocaine tetracaine for at least 60 minutes. And then people have to be freshly shaven. We clean them with isopropyl alcohol. And then we cover the axilla with elastin nectar or Neocutis bio cream for 48 hours. Most people are healed in that time and can wear deodorant on the 3rd day. What I have found so far is most people doing 2 to 3 treatments have had a decrease in sweating and odor up to 6 to 9 months. I've had one patient up to 12 months, but now everybody has come back and either needed additional treatments with the Morpheus or Botox. My take is that the results are similar to Botox. It's probably not permanent, it's probably temporary, but some people prefer Botox and some people prefer Morpheus. I think it's just whatever your preference is. I think they both work in a temporary fashion. So just a few quick pictures to finish up. Here's a nice picture of Morpheus with that solar elastosis or photoaging around the eyelids. Here's the same lady with a frontal view around the eyelids. A lady with really nice tightening in the lower face and neck with Morpheus. Another lady, lower face and neck, really nice tightening with the Morpheus. A younger lady who was looking for nasolabial lifting and neck contouring. Another lady, lower face, submental tightening, fine textural improvements around the lower face and mouth. Here's a patient of mine, was thrilled with results. She has the really hard punched out boxcar scars. They were all over her forehead, temple, and cheek. She could probably do more treatments, but she thought this was life-changing. She'd already had CO2 with no improvement. A gentleman that I did one Fractura on, he had a second, but then he never came back for photos because he was in the military. But he actually had improvements in both his acne and acne scarring in a type 4 Asian patient. Another lady was thrilled with her results. 2 treatments with Fractura at the 24 uncoated and the 60 pin. Here's somebody before and after 2 treatments with tightening on the knees. And here's a lady, advanced combination. She had 5 fracturas spaced out over 5 years. I apologize, in my earlier days, my earlier esthetician had that lady in a neck turtleneck, which she never should have done. But with her having aged 5 years, she looks better and better. She did Forma in the middle, and basically every other year has come in for Fractura just for skin tightening with the coated tips. And it's had a tiny bit of HA filler in the mid-face. And then here's one by Dr. Emer with Fractura and Bellafill in this gentleman. And that's it. So I just wanted to first say thank you to all the participants who have tuned in, and thank you to InMode for hosting this webinar and for the opportunity to share some of my experiences. And with that, we'll open up to questions.
Natalie, that was fantastic. It was a very comprehensive talk. I think people who've been in your shoes probably understand how hard it is to take a 4-hour talk probably and condense it down into 45 minutes. So thank you. I appreciate it. Everyone else. I'm going to start off with a few questions, and I think there's some questions that are coming in also in the Q&A. If you're typing in your questions, please type in the Q&A box, not the chat box. It'll be easier to keep track of them. So, you know, I think most of the questions you're going to hear are going to be, from what I'm seeing, about Morpheus8. But before we jump into that, can we, with regard to Lumecca, I saw you mentioned some stuff about settings and using the 515 filter and so forth. When you treat, you know, say face, neck, and chest in the same person, do you use the same settings across all 3 areas, or do you happen to decrease the settings across the neck and the chest?
Yeah, so the chest, I feel like the skin gets more sensitive as you go down, the neck being more sensitive than the face and the chest being even more sensitive than the neck. So typically I'll go down in the energy on the neck, but I definitely use the lowest energies on the chest. And often when I do the chest, the first time, especially if the person is quite photo aged, I'll only do 1 pass on the chest.
Yeah, I think I'm the same way as well with regard to that. I tend to decrease the settings as I go lower. Do you happen to use ultrasound gel? I know the older IPL models, you had to use ultrasound gel. Do you still use ultrasound?
Oh, yes. Yeah, thank you. That's a great point. I use ultrasound gel for my vascular laser and for the Lumecca IPL for sure. And I think more is better than less.
Me too. I use ultrasound gel as well. And then I have one question for you with regard to Morpheus, and then I'll start going through these questions that the audience had as well. So as a Mohs surgeon, obviously both of us have a lot of scars. Have you used Morpheus8 for management of scars? And if so, what's your timing when you use it? You know, how many weeks after or months after?
So depending on the scar and what the situation is, that someone just a little red, then I'll typically use a vascular laser. If it's a very small scar and it's just textural, I can use like a fractional non-ablative laser, like a 1565 fiber laser with no numbing, and that's a lot quicker. I'm gonna have to charge a lot more if I have to sit and have people numb for an hour just to, and pay for a disposable tip, where my other lasers don't have consumables. So if somebody comes to me from an outside practice and needs half their face done, then it's gonna be that. So I typically will use Morpheus on, like, a perfect example is I had a patient who came in and she was building a house and fell off the 2nd floor onto the 1st floor because the banister wasn't installed, and has gashes all over her face. And so we talked about, do we want to use a non-ablative or do we want to do Morpheus? And there were so many scars. I said, by the time we do all that with non-ablative, you're going to be paying what I would charge for a full face Morpheus. So she's going to numb up and do the Morpheus. So I think for smaller surgical scars, it's not going to be cost effective for the patient or for my time.
What kind of settings do you use when you use Morpheus for scars?
Um, I think it depends on the area. I mean, like if I'm doing an abdominal scar, it's going to be a different setting than if I'm talking about someone with like a linear scar on their forehead. You know what I'm saying? It just doesn't make a whole lot of sense just for like one small scar or a small flap on the nose to numb and take the Morpheus out for all of that.
So one of the questions I see from the audience that seems to be recurrent is they want to know the difference between Fractora and Morpheus8, if you don't mind talking about that a little bit.
Sure. So the Fractora handpiece, shoot, I wish we had a better picture, was the handpiece was fixed with the needles out. So the Morpheus, I'm sure you saw in the video, it looks like a gun with a foot pedal trigger that kicks the needles out. So you had to actually hand press down every single stamp, every single spot. And it had 3mm needles that were either coated or uncoated. And then it had 0.6mm needles that were uncoated. So that was the only options for the Fractora. The Morpheus, on the original handpiece, all of the needles that you can adjust the depth to 1, 2, 3, and 4mm are only coated. And then the resurfacing tip, which is 0.5mm, which would be similar to the Fractora, 0.6mm, are uncoated. So there were people that were like type 1 or type 2 skin like me that I would do an uncoated treatment, and they would just come in for one treatment. We would use higher energies, and it would take them about a week to fully recover with some residual erythema. Now with the coated tips, we recommend that everybody has 2 treatments, like what we were doing on type 3, 4, or 5 skin before, to get the results that they need, but it's quicker recovery. It's less painful. With the Fractora, we were doing nerve blocks and injectable numbing. It was more painful. Not sure if there was a more specific question than that. The heating wasn't as uniform as it is with the Morpheus.
Yeah, I agree. I think that the Fractora tended to be a bit more painful, especially sort of in this infraorbital region, whereas the Morpheus is a lot more tolerable. The other thing I think was different is Fractora was, and you suggested it as well, which was with regard to heating. Fractora was bipolar, whereas you have a lattice structure with Morpheus8, which causes a little bit more bulk heating and also deeper depth. Somebody asked the question, can you do Fractora and Morpheus8 at the same time? And is there a rationale for that?
I mean, I guess in theory on fair-skinned people, you could. I mean, with the 0.5 and the 0.6 tips, you wouldn't really need to do those at the same time. You know, you would pick one or the other. You know, I had people that would want the coated and uncoated tips of Fractora at the same time that were fairer skin. One for just the full ablation all the way down, and then some people for the tightening. I had people that would want, they called it like, we would call it low level RF with microneedling, that would want it at like a setting of 15 energy, like super low, just to have the holes open where they could put cosmeceutical products in deeper. So I guess you could do a full treatment at like 35 with the coated tips of the Morpheus. And then if you wanted some full damage down 3mm, you know, epidermal, dermal, on a lower heat setting, you could do it together. I mean, in theory, you could do a pass of each, or do a 2mm depth with a Morpheus and a 3mm. I mean, you could really do whatever you want as long as you have a reasoning and a goal and the patient's best interest in your outcome.
Yeah, it seems like with the resurfacing tip that's come out, it's probably a little redundant to use, unless, you know, the main reason is to get epidermal, you know, damage if you want to use Fractora. So I agree. I think I'm the same way as well. Somebody asked, so you had a slide that said an absolute contraindication to Morpheus was pacemakers. So the question here is, do you treat patients who have pacemakers?
So we have. You know, I'm very cautious both with surgery and stuff. I usually do talk to the person's like cardiologist about what the situation is and what the device is, and just see, you know, is it we had a lady with she wasn't sure she had a defibrillator and a pacemaker. So I mean, I definitely call and talk to them and describe what we're doing and speak with the person, like not their nurse who probably has no idea what they actually have, but actually the cardiologist myself, and just get a Ganter on exactly what's going on. And is this a safe treatment? But I'm like not going to do a treatment on somebody whose cochlear implant is fused into their skull or anything like that.
Yeah, I think you're right. I think if you're doing anything off-label, it's probably best to get at least confirmation from the physician who's managing that. So the cardiologist would be a good person to go to. There was a question about the timing of the photos for Morpheus8 and some of those photos. Do you know when some of those, on average, was it after one treatment, two treatments, when the photos were taken before and after?
On my patients?
Probably, I think you can only talk about your patients because I don't think.
So except for the woman who I had said had done like 5 treatments or whatever, you know, over 5 years, I showed her like her oldest, one of the ones in the middle, and her N1. Everybody was shown before their first treatment and 12 weeks after their last treatment. Because sometimes people don't do their second treatment exactly at 4 weeks. Some people want to wait 12 weeks. I mean, I can't force people to come in sooner, even though I can suggest they might get better results if they put them 4 weeks apart, but some people want to wait.
And you're typically doing your treatments every 6 weeks apart, correct?
4 weeks apart.
4 weeks apart, okay. And then what are, there's a question here about how do you avoid getting bad coupling signal? Probably you can talk about it with all the devices, you know, with Forma as well as with Morpheus.
So with the Morpheus, that's where I put that slide in about like the firm pressure, pinching over bony areas, smoothing over softer areas to really prevent those like superficial arcs, which is a sign that you're not using good technique. I've really never, I mean, we've never had problems with the Forma.
Okay.
I don't know if it's just a lot of practice or what.
Speaking of Forma,
Forma needs a lot of gel too. Speaking of like the ultrasound gel, I mean, you need a ton of gel, and you need to, and we actually started heating our gel because we were, when the gel was sitting out cold on the counter and you'd put it on the face, you would lose the heat. So we have it in like a gel warmer.
Got it. And then there's a question here about possibly triggering, is it possible to trigger melasma with Forma, with the heat?
So, you know, I have a serious conversation with people with melasma because it is a serious disease, and anything that heats the skin can make melasma worse. So, I mean, I won't touch people with IPL. I won't do a full face laser hair removal. I won't do full face like XLV, which is the vascular laser I use. I will like treat pinpoint angiomas because if it gets worse, and I've seen people who've gone elsewhere and had that and come into my office and are like, I want you to fix it. So generally, I will not recommend Forma to someone with melasma because, you know, you're getting bulk heating from the epidermis down to the fat. And we know the heating more likely higher up near the epidermis and DE junction is more of the problem in most people. But going all the way through the dermis down to fat, you're just going to give it an impetus to worsen.
Yeah, I tell some of my patients that the only thing predictable about melasma is that it's unpredictable.
Unpredictable, yeah.
What settings do you use? Do you treat patients with fat protrusion under the eyes? And if so, what settings do you use for those patients?
I do not. Like for Morpheus? You're talking about the Morpheus?
Yeah, I think this question probably has to do with Morpheus.
No, I do not. I usually send them.
The facial plastic surgeons talk about using it for
Right.
you know, changing the composition of the fat and hopefully helping with some tightening as well.
Yeah, the only place where I've done like a 4 millimeter depth is like if somebody has a lot of submental fat and they've asked me to go like 4 millimeters here to see if we can do some like contouring in the submental area, but not like in the eyelids.
And then how about, you know, so there's a question here about we're dermatologists, and so we see patients with active acne, active rosacea, things like that. Have you ever tried using Morpheus in a patient with active acne, and do you think it's helpful? Do you think patients should wait?
So I would say about half of my Fractura and Morpheus patients over 6 years have had acne scar. And of course, a lot of those people have had active acne as well. Not everybody is just kind of past that stage. And so, you know, you're saying about unpredictability with melasma. What I tell people is they say, will it help my acne? Or, hey, I don't want to take pills. I don't want to do Accutane. I can't take Accutane. I don't want to be on antibiotics. What can you tell me? And I said, what I can tell you is in some people, it significantly improves their acne. And in some people, it does not. And I can't look at a magic ball and be like, you're the one I'm going to be able to fix your acne. I've had people that have done a series of Fractora who their acne has never come back. And I've had people that have been on Accutane, they have severe scarring. They're like, I'm thinking about another course. We've done some Fractora. Their acne scarring looked tremendous. And they've gone on another course of Accutane. And then their acne got better. You know, the device didn't help at all. But it's hard to know. And what I've seemed to kind of canter from experience is that people who've got huge, really, really deep cysts, we just can't get deep enough to obliterate the sebaceous glands causing it. People with more superficial inflammatory bumps that have just been recurrent, those are the people that it's helped more so.
Yeah, I think we do the same too. Sometimes I'll put patients on antibiotics and then after that maybe try, Fractora or Morpheus. And it's been sort of, in some cases, in some instances, the results have been pretty good. But again, in some patients, it doesn't seem to help.
Yeah.
There's a question about resurfacing tips, and when do you use those tips? And can you comment on?
So last year I used a bunch of them when they first came out, just to see, like, I do it with one treatment and not with the second, just to see if people had results. What I have found very impressive about the Morpheus devices is I've had, just using the 3, 2, or 1 millimeter on the regular tip, people have had impressive improvements in skin texture that I haven't had many people, unless we were dealing with really intense scarring issues, a need to use them as much as what I felt like I needed with Fractora. Because you're getting such phenomenal results from the regular tips.
Mm-hmm. Mm-hmm. Yeah, I agree.
Not that they're bad, but I just think the regular tips are fantastic. They're unbelievable.
Do you, when you double stack with Morpheus8, there's a question here about
Like double pulse, you mean?
yeah, I think that's what they mean, the double pulsing, back to back. How does that affect temperature? Anything you
I
know
mean,
about
it's going to increase tissue temperature for sure. But if I'm double pulsing, like in the cheeks, I don't ever like double pulse and then do my second pass. I do the whole face, and then I will come back and do that area again. So that
that? You
gives the
down a
tissue
little bit,
time
as you're
to
saying.
cool. Yeah.
Yeah. For Lumecca, back to Lumecca, what are the settings that you like to use for rosacea? And I guess rosacea is kind of hard to say
Well,
because
so
there's
I will be honest, I have never ever used the 585 filter because I have XLV, so I use that for all my vascular things. I only use the 515 for pigment.
yeah, it's interesting. I'm the same way. I even treat type 4s with 515 and it's been safe in my
Yeah, I have
practice.
to. Mm-hmm.
I know that the company recommends using the 585, but I rarely use the 585 as well. Even for rosacea, oftentimes I'm using the 515 filter.
Yeah.
So let me see what else we have here. I think we answered that one. Can you tell somebody asked a question about the Zimmer chiller. Can you comment on that? What is that?
So it's a device that blows cold air out, and when you're cooling off the skin, it makes it a lot less painful for people, because some of what they're feeling as pain is like heat in the skin. And I can tell you, I've had my axilla treated for axillary hyperhidrosis. It's the difference between having a pain level of 2 to 3 versus like a 10 in the axilla. So in the axilla, I mean, I've never had my face done with Fractora Morpheus, but oh my goodness gracious. I mean, there's no way I could have my axilla done, even with the 60 minutes of the lidocaine, without the Zimmer. So some people, especially if people get hot and flush, really need it in the face. And some people, like I said, they're just too cold. They're like, my face doesn't feel that hot. I don't really want it. I don't force it on people. But I have never had somebody turn it down when we've done Morpheus in the axilla.
And then I think we have a few other questions, but we're kind of running out of time. I'll just ask one more.
Okay.
The rest of these, we're happy to answer them after the session is over as well. So you mentioned a little bit about the use of PRP and
Yes.
Morpheus for rejuvenation. Can you comment on if Morpheus has any effect on hair loss, as in promoting hair loss, and then also the opposite. Have you thought about using
Morpheus or PRP?
Well, Morpheus causing hair loss? There's a question about that. And then
Like on the
Morpheus
face?
and PRP actually promoting hair growth.
Yeah. Morpheus on the face?
Morpheus on the face for hair loss, like in men, bearded areas.
Yeah. I have never seen any of that. They call it shock alopecia on the face. And, you know, I have a lot of colleagues that have this device. I'm not aware of any cases.
And then
I do a lot of men.
yeah, I haven't either. Have you ever used Morpheus on areas where you want to promote hair growth in conjunction with PRP? Say eyebrows or
No, and you know, my worry would be that it could potentially burn some of the hairs. I use PRP for hair regrowth on the scalp in both men and women with like androgenetic alopecia. And I have had success with that. I've gotten actually a lot more into that in the past year because for people that can't use, you know, spironolactone in women, Propecia in men, they're allergic to minoxidil, or I had one woman who just came off cancer therapy and had alopecia areata and wasn't allowed to use steroids. So people have a lot of restrictions. PRP was their only option. And I've been very impressed with the results I've seen for hair growth. But I've never used that with any kind of like laser that would break the skin.
yeah, I think I'm the same as you. I don't have experience with that as well. Okay, well, thank you very much for this presentation, for answering all the questions, and thank you, the audience, for taking your time to listen to Dr.
Thank you,
Curcio.
everyone.